Welcome to your 2014 City of Knoxville Benefits Enrollment. During our time together, we will review our current options, show you some new plans, as well as offer some reminders and enrollment information. Meet Christy Branscombe, our COO and Deputy Mayor. She is reaping the benefits of My Health in the Center, and so can you. Let's start by reviewing changes to your benefits for the upcoming year. First, let's start with medical changes. Medical plan per paycheck premiums will increase for all plans with the exception of $1,000 S. The utilization in all other plans warrants an increase. Additionally, as part of the Affordable Care Act, emergency room copays will count toward the out-of-pocket maximum for all $500 deductible plans. We also made some changes to dental and are offering some new buy-up options. Stay tuned and we will talk about those a little later in this presentation. Beginning in 2014, the City of Knoxville will cover domestic partners. If you would like to add your domestic partner, complete an affidavit, as well as provide proof of the relationship through financial interdependence. For more information about the affidavit and proof, or the tax implications, please contact citybenefits@cityofknoxville.org. Now that we've discussed the upcoming changes, let's talk about medical coverage. When you enroll for city medical coverage, you have three choices to make. You must choose your network, your deductible, and whether you want to participate in the My Health Wellness Rewards program or not. You have two network choices, S and P. They are both PPO networks. The benefits are the same for both the S and P network. The only difference are the providers in the plan. Network P includes 98% of Knoxville area physicians and all Knoxville area hospitals. Network S is only slightly smaller at 88% of Knoxville area physicians, the biggest difference being that Network S does not include Summit Medical Group. All area hospitals except Tenova are included. You are responsible for making sure the providers you see are in network. The only exception is if you see a doctor in the emergency room. For any follow-up visits, make sure they are in your network before you make an appointment. It's important to remember as you choose your network that Network P costs more than Network S. That's because Network P has more participating providers, and those providers have not agreed to discount their services as much as providers in Network S. But Network S also has many participating providers and hospitals. Many city employees are enrolled in Network P but are not using it, either because their doctor also participates in Network S or because they haven't seen any providers in 2013. If you're enrolled in Network P, now is a great time to check if your doctor participates in Network S. If not, would you be willing to change doctors? Now let's look at your deductible options. You can choose the $500 deductible option, in which case you'll pay more in employee contributions. Or you can choose the higher $1,000 deductible option and pay less out of your paycheck each pay period. Let's compare. You can see the $500 plan has a $500 per person or $1,000 per family deductible. The $1,000 plan has a $1,000 per person or $2,000 per family deductible. Both options have the same coinsurance and the same maximum out-of-pocket. So with any plan, once you meet your deductible, the plan will pay 80% and you will pay 20% until you meet your maximum out-of-pocket. And the most you'll pay out of your own pocket in 2014 is $2,000 per person or $4,000 per family, regardless of the option you choose, provided you stay in network. And notice, all plans cover preventive care at 100% with no deductibles or copays required. So if you're currently enrolled in one of the $500 deductible plans, should you switch to one of the $1,000 deductible plans? This is a really important question to ask yourself. And here are two more. Do you meet your deductible each year? If not, why are you paying higher employee contributions for a lower deductible? And second, do you have money in your HRA? Some city employees have accumulated a lot of money in their HRAs. This is money that can be used to pay for expenses, including those toward a higher deductible, and you avoid the higher paycheck deductions. Which leads us to the last and probably most important choice in selecting your medical coverage: My Health or medical only. The My Health plan is medical and prescription drug coverage with built-in rewards for committing to a health-conscious lifestyle. The medical only plan is medical and prescription drug coverage without the built-in wellness rewards. Employees who choose to participate in My Health and maintain all of the requirements pay less per paycheck, sometimes significantly less than employees in the medical-only option. Why join My Health? Let's look at our peers. They've stopped smoking. They are eating better. And many are learning how to manage chronic conditions that might otherwise threaten their lives. The rewards are plenty. Lower medical premiums, free or reduced prescription copays for certain medications, for people who live with certain chronic conditions, free testing supplies, and HRA dollars from the city up to $918 a year. Let's look at the HRA dollars more closely. As a My Health participant, you will also earn HRA dollars, $32 a month for employee-only coverage, or $64 a month if you cover dependents. If you earn less than $43,220 a year, you will receive additional HRA dollars from the city. And if you or a covered dependent participates in the center's prenatal program, you can earn $200 in your HRA. You can use your HRA dollars to pay for qualified medical, prescription, dental, and vision expenses incurred by you and your eligible dependents. This includes out-of-pocket expenses that count toward your annual deductible, copays, co-insurance, and other eligible expenses. Not all expenses are eligible, though. You can visit wageworks.com for a complete list of eligible expenses. This web address is listed in your 2014 Guide to Your Benefits. If you don't spend all of your HRA dollars during the year, they roll over to the next and are available to you as long as you remain covered by a city-sponsored medical plan. This includes COBRA and retiree coverage. If you expect to have out-of-pocket expenses greater than the HRA dollars you'll receive from the city, you can contribute your own pre-tax money to the healthcare FSA. Since any leftover FSA dollars are forfeited at year-end, expenses are paid from your FSA account first. When your FSA funds are gone, expenses will then be paid from your HRA. To qualify for My Health rewards, you must receive an annual health screening, be physically active and complete a monthly physical activity affidavit, complete quarterly health education, manage any chronic conditions you have, including tobacco use, and seek an annual well care visit for your covered children. The prenatal program is optional. Check out Mike, a great example of how My Health can be the start of a positive change. We're cool with that too, Mike. If you choose not to participate in My Health, but still want city-sponsored medical and prescription drug coverage, you can enroll in the medical-only option. Medical and prescription drug benefits are available for medical-only participants, but premiums for medical-only coverage are higher than My Health, and there are no built-in rewards such as HRA dollars and lower prescription drug copays. We've shown you the math before, but this is some pretty powerful stuff. Bear with us while we do it again. Say you want employee-only coverage. You choose Network P, a $500 deductible, and medical only. You would pay $60.41 per paycheck for coverage, or a little over $1,400 per year. Now say you just make one little change from Network P to Network S. Everything else stays the same. Your paycheck deduction would drop to $29.21. Your annual cost for coverage would drop to roughly $700, saving you close to $750. Now say you make two changes. You not only switch networks, you also switch to the higher deductible. Your paycheck deduction would drop even further to $12.10 per paycheck. Your annual cost for coverage would drop to less than $300, and you would save over $1,150. Are you thinking about what you could do with over $1,100? We thought so. So here's the grand finale. You make all three changes, the network, deductible, and enroll in My Health. You're now paying a whopping 54 cents per paycheck. That's $12.96 a year. And you're saving over $1,400. That's $1,400 that is not coming out of your paycheck. And that doesn't even factor in all the rewards you get for participating in My Health, which would be an additional $384 a year. Let's do this one more time with family coverage. If your coverage is employee plus spouse or employee plus children, you can count on saving somewhere between the single example we just did and this example. So again, say you choose Network P, the $500 deductible, and medical only. You would pay $291.31 per paycheck for coverage, or $6,991.32 a year. If you simply switch from Network P to Network S, your paycheck deduction would drop to $200.33, or $4,807.92 a year, and you would save over $2,100 a year just for switching networks. Now let's add a higher deductible to the new network. Your per paycheck deduction would drop even further to $139.26. Your annual cost would drop to a little over $3,300, and you would save nearly $3,650. Again, you increased your annual deductible by only $500, but you're saving nearly $3,650 in paycheck deductions. Finally, let's say you really want to save and get healthy in the process. You make the network and deductible change and sign the family up for My Health. You're now paying less than $110 per paycheck, or just under $2,600 per year. You're now saving $4,400. That's $4,400 not coming out of your paycheck. And, of course, that doesn't factor in all the rewards you get for participating in My Health, which would be an additional $768 a year. Wow. The bottom line is, deciding what plan is best for you and your family is a decision that needs to be made with some thought and a little math. We are here to help. Just like Robin, we think there's more to it than financial gain. That's the obvious reason, but do it for your health. If you don't plan to enroll in city medical coverage, you can still earn some rewards even if you waive medical coverage. If you can provide proof that you have medical coverage elsewhere, the city will make a $500 contribution to a healthcare FSA in your name. You can then use those dollars to pay for eligible healthcare expenses incurred by you and your dependents during the year. And if you complete the annual health screening through the center and fulfill the physical activity requirements we talked about earlier, you can earn a $20 per month physical activity incentive. You can also use acute care services at the center for a $5 copay. Your prescription drug coverage is part of your medical plan and is offered through Humana, so you have a separate ID card. Use your Humana ID card at the pharmacy. Take a look at the next slide to see the copays under our plan. Here are the copays for prescription drugs. Remember, if you choose My Health, you'll not only receive discounted prescription drug copays for medications used to treat chronic conditions, but you will also pay lower copays for non-preventive brand medications as well. It's important to know if requesting a brand name drug, when a generic equivalent is available, you will pay the generic copay plus the cost difference between the brand and generic drug. You can review drug lists at cityofknoxvilleRx.com for more information. Now let's turn our attention to the center. Most of you are already familiar with the city's Health, Education, and Wellness Center, also known as the Center. You don't have to be enrolled in My Health to use center services. All city employees can use the center, but My Health enrollees receive services for a lower copay. Every quarter, the center offers free health education classes on subjects like nutrition, exercise, diabetes management, and more. Although these classes are open to anyone, My Health participants can attend them to meet their quarterly education requirement. The center also provides free health coaching for employees with specific health concerns. The center staff will work closely with you to help you achieve your goals and empower you to take better care of yourself. The center also provides treatment for short-term illnesses for a small copay. You and your covered dependents ages 13 and older can take advantage of these services and pay with cash, check, a debit or credit card, or your WageWorks card. The center is run by Summit Medical Group, and all staff are bound by the same confidentiality requirements as any other healthcare provider. HIPAA privacy rules require that your health information be treated confidentially, and the center abides by those rules. That means that the city never sees your personal information. Your 2014 Guide to Your Benefits provides more information about the center, including the address and telephone number. Although I've spent most of our time talking about your medical options, there's much more to your city benefits, including dental, vision, flexible spending accounts, life insurance, and voluntary products. You can read more about each of these benefit plans online at cityofknoxville.org/benefits. Your 2014 Guide to Your Benefits provides descriptions of each plan. But let's take a quick look at your other benefits. Dental. First, the city provides a free base dental exam to all benefit-eligible employees, even if you waive coverage. That includes an annual exam, a cleaning, and a set of bite wing x-rays for you. Your spouse and children are not eligible for this base plan. Remember, I said we'd talk about the changes to the dental buy-up options. It's that time. If you are currently enrolling in a buy-up dental option, you'll want to pay attention. It was time to do an RFP on dental, and our goal was to make the dental easier to understand. After facing a 17% increase on our current options, we also wanted to make them more affordable. Therefore, we have created new plans with Delta, a low option and a high option, as well as continuing the Cigna DHMO. Take a look at this chart and let me walk you through the differences. Here's what we did. We created a low and high option with Delta. We also added a new benefit to help your annual maximum be there when you need it. Preventive services will not be deducted from your annual benefit maximum, so you'll have more available for basic and major services. These plans are easier to understand too. The low plan has a lower annual maximum of $1,000. Based on our reports, the vast majority of employees were spending less on dental. The high plan not only has a higher annual maximum, but it is the only option with Delta that includes orthodontia. More good news, neither of the plans includes a waiting period for any services. The Cigna DHMO will continue to follow the same patient charge schedule. Now take a look at the premiums and let me tell you a little about networks and some other important things to know. With Delta Dental, you can visit any dentist. The benefit percentages are the same for out-of-network, but the difference is you could be balance billed if you see a non-network provider. Discounts are available. If you are in the base plan or if you go over your annual maximum, Delta will pass along its discounted rates to you. Cigna's DHMO plan does not allow for out-of-network dental benefits. Their dental network is small, but their premiums are low with attractive copays for services. Regardless of which option you choose, be sure to choose wisely. Changes can only be made throughout the year with a life event. The city also provides all benefits eligible employees with an annual eye exam for a $10 copay if you use an iMed provider, as well as discounts on products. You don't have to be enrolled in the vision plan to receive this benefit. You can purchase additional vision coverage for yourself and your eligible family members, which covers exams, lenses, frames, and contacts. If you choose to enroll in the vision plan, there are no changes in rates or plan design for 2014. There are no changes to the rules of the FSA. Just remember, if you want to participate in one or both of the city's flexible spending accounts, you must re-enroll each year. Your 2013 FSA participation does not automatically carry over. The maximum you can contribute is $2,500 to your healthcare FSA and $5,000 to your dependent care FSA. Finally, a very important reminder, FSA and HRA dollars can only be used for eligible tax dependents. For more information on eligible expenses, review the 2014 Guide to Your Benefits or visit wageworks.com. As a reminder, the city provides basic life insurance coverage equal to $50,000 at no cost to you. You can purchase supplemental coverage for yourself, your spouse, and/or your dependent children. Each year at annual enrollment, you can increase your supplemental life coverage by $10,000 or $20,000 with no medical questions asked. If you make any other changes to your or your spouse's coverage, you must complete an online evidence of insurability for approval by the insurance carrier before your coverage increase can go into effect. Additionally, for 2014, spouses are now eligible for up to 100% of your supplemental life insurance. More information on the city's life insurance is in the Guide to Your Benefits 2014. Vacation Sale, formerly Benefit Bucks, can be done at annual enrollment. You have to re-enroll in selling your annual leave each year. This year, you can sell up to 50% of leave accrued for the current plan year. Enrolling in Sick Leave Bank will require a paper form this year. See Employee Benefits if you would like to enroll. If you have enrolled in the past, you do not need to re-enroll. The city makes several voluntary plans available to employees, and this year is adding a new short-term disability option to the current lineup, which includes lifetime benefit term insurance, cancer insurance, critical illness insurance, and accident insurance. Meetings with Benesync will take place after annual enrollment. Stay tuned for more information. Now that we've reviewed upcoming changes to your benefits and given you a more in-depth look at the plans available to you, it's time to enroll. You have until November the 8th to make your 2014 benefit elections. Enrolling is easy. Just go to Inside Knoxville and choose Online Annual Enrollment 2014 from Citywide to get started. If you don't go online to enroll before November the 8th, your 2013 benefits will continue in 2014, except FSA and Vacation Cell, formerly Benefit Bucks. You must enroll to continue these plans. Also, if you are currently enrolled in one of the Delta buy-up options, you'll need to make a new election to continue buy-up coverage. Otherwise, your coverage will default to the base dental plan. Once your benefits for 2014 become effective on January 1st, you generally can't change them during the year unless you experience a life event, such as getting married or having a baby. Life events that allow you to change your benefits mid-year are listed in your 2014 Guide to Your Benefits. Everything we've talked about is here in your 2014 Guide to Your Benefits, and as always, the guide is available online at cityofknoxville.org/benefits. If you have any questions along the way, Employee Benefits is here to help. Thank you for your time.